cushion, but I was supposed to pour the milk in the hat and then put the hat back on, and no milk come out. Did milk come out?
Yeah, the milk comes out.
Oh, shit.
Painful to watch, but you know what's more painful? These painful medical devices. I cannot believe some of these were actually improved. Click here, check that out. As always, stay happy.
Imagine this. A mild to moderate eczema treatment that helps clear skin without pills, injections, or steroids. Imagine using one single cream to help the itch. No, it's not imaginary. It's Oxalora, eczema treatment reimagined. Oxalora is proven to help clear or almost clear skin and significantly reduce itch fast. Imagine that.
Oxalora can lower your ability to fight infections, either hepatitis B or C. Serious blood infections, skin cancer, blood clots, and blood loss occurred with Oxalora. People taking JAK inhibitors, serious infections, increased risk of death, lymphoma, other cancers, and major cardiovascular events have occurred. The most common side effect was the common cold.
Imagine an eczema treatment you can apply wherever you need it, like here and here. That's Oxalora. Relief reimagined. Ask your doctor about reducing eczema itch fast with Oxalora.
Family Guy, you're next. Last week's full scare got me thinking. I don't know anything about my genetic makeup. What other illnesses I might be susceptible to. You know what's funny about this? There's actually a genetic test for dogs. I actually did it for Bear and Roxy. Turned out they all what we thought they were. They are who we thought they were. So it made me want to do a 23 genetic test. I think the one I did was clung in bark. Proving the smokers to like caffeine. It's so true. That's such a problem with these genetic tests. Oh my god. Like so many of them will give you information that is genetically accurate to some degree. And they tell you something you cannot practically act on at all. You know, we have a higher likelihood that you may live 5 years less than a normal person. What use is it to know that you are potentially have a higher risk for Alzheimer's disease? It's just like flexing. Genetic people are like, ah! I don't have the Alzheimer's gene, that's good. See, I knew it! It says I don't have the Alzheimer's gene, so that's good.
How would you like to be a male nurse? Do I get to wear those green pajama clothes all day? Yes.
AKA scrubs. They're not, although they are kind of comfy like pajamas.
Today I need you to observe surgery.
Why are they attaching ventricles of the heart? I'm so confused with surgery he was looking at. I could have sworn the abdomen was open. There are operating theaters where you can watch operations be performed. It's great for residents, fellows, even other doctors that are trying to learn. I don't think they let family members do that. I have seen it on Grey's Anatomy, but I've never seen it in real life. It goes to show. That looks like a weird ECG pattern. Oh, flatline. You know what we do? Just compression, just compression, just compression.
You gotta live, damn it! I need you!
Okay, those are not the chest compressions. Okay, so ACLS, advanced cardiac life support, would not tell you to punch a chicken. Just want to put that out for the record.
What are you doing, Peter? I'm making my own Red Bull. This can't stop me from experiencing the manic highs and lows my body demands.
Kerosene? Why is he putting kerosene? Red Bull has a lot of stuff in it, like 80 milligrams of caffeine, chlorine. If you want a caffeine boost, like just have a cup of coffee. It's more natural. There's actually polyphenols in there because it's plant-based. Coffee beans are just better for you. At least our research shows that.
The drink will kill you. Brian, whatever kills me makes me stronger.
He messed that one up.
See, Brian? I feel great.
Peter? Peter, are you alive? Poison hotline. Snap. By the way, did you know that there's a nationwide poison hotline?
All the toxic chemicals your husband ingested from this homemade energy drink can cause total kidney failure.
Total kidney failure requires dialysis and quick, where you essentially take the blood outside the body, clean it, and process it the way the kidneys do, and put it back into the body.
the same 293 pounds today that I weighed in grade school.
Perhaps it's this lump on the side of your neck, sir.
Oh my God, he has those. How long have you had that thing?
I don't know.
We gotta go see Dr. Hartman right away.
Clear differential diagnosis: Cushing syndrome, lipoma, a soft tissue mass, like a sarcoma. Could it be a lymphoma and he has a swollen lymph node there? I guess that's possible as well.
No, you're stupid. Oh, hello, Reynolds. What can I help you with today?
That should be a warning sign if you walk into a doctor's office and they're just yelling at a patient. You're stupid.
Dr. Hartman, Peter has a huge lump growing on his neck.
Mrs. Griffin, that's called an endocrine. Fool by that one.
Take a look at it. I think it might be a tumor.
Okay, let's have a look. It appears you have a subcutaneous vestigial twin growing on your neck.
Is he saying that it's a teratoma with just by touching it? I mean, that's very impressive that he was able to diagnose it. So much so that it is not real. A teratoma is basically a type of tumor that has all sorts of different stem cells in it, where they start growing different cell lines, like hair, teeth, muscle. You cut it open and there's just like almost a twin in there. Like, it's crazy if you can have human remains almost.
Now hold still. I'm just going to give you a little topical anesthetic and we'll have a closer look.
What? Ow, that would not... You'd need injection anesthetic. A little lidocaine.
Hey, everybody!
He did a skid flap, though. That's impressive.
Get up, we're late.
Oh, he does not look good. He looks like he has anemia, potentially some dehydration there. Oh my God, jaundice, like there's a little yellowing of the eyes.
How did this happen?
It's from smoking.
Oh,
Not that bad.
Peter, you can't live like this. I'm taking you to Dr. Hartman.
Oh, I'm in the dark.
it's like a madness. I'm not gonna lie. I have some patients that come in and are like, oh, like, when's the last time you went to a doctor? They're like, 3-4 years. Most people I hate going to see a doctor. I hate that. And I'm like,
I'm going to need to ask you a few questions. You think I can jump and touch that lump up there?
I don't know why. I always used to do that as a kid. Street signs, crosswalk signs, scaffolding. Always used to touch that. I love sanitation.
Dr. Hartman, you can't be to help Peter quit smoking.
I can't do that. It's an addiction.
Well, you gotta do something.
Well, we absolutely do something. Not only do we have behavioral treatment options, we have pharmaceutical options for it, including nicotine patches, oral medication. All of them are not right for everybody. You have to do it individually, discuss with your doctor to figure out what's right for you. And the first step of quitting is contemplating. I guess even before that's understanding why quitting is important.
But Dr. Hartman, why did he lose consciousness?
Well, keeping in mind the recent behavioral changes you described, I did a CAT scan. Want to go on?
Oh, that's actually pretty funny. God, you're so scared.
However, I'm sorry to report you that mine was great. So, Doc, how much calcium juice do I have to drink to cure this? And I've also heard that, like, crystals, is this?
He's been reading a little bit too much of
Do you think the brain's tumor might explain why Brian's been acting so odd lately?
I haven't heard of brains being linked to behavior, but I suppose anything is possible. It says here, Brian's tumor is for office use.
Benign, it says benign.
tumors can either be described as benign or malignant. Malignant meaning that they're problematic, they can spread, they can actually cause you to die. Benign tumors usually, the only way they can cause a problem is if they can turn malignant, or if they become big enough in size where they exhibit mass effect, putting pressure on other structures, causing them to malfunction.
Is my father gonna be okay?
That house that needs Oh, they got Gregory House for this. Wow.
Dr. House, if you're gonna save this patient, you'll need this.
Stay down on my side.
Wait, is that not even, is that someone doing his voice?
Wait a second, how are you going to play by the rules if you don't have the rules?
My methods are a little unorthodox, Mr. Griffin.
Oh, what are you doing?
My job is a back to maintain plus horse punch, knock him out.
He literally is the type of doctor that's like, alright, let's poison the patient and see if they recover. And I'm like, that's not really how you practice medicine.
Sir, I think you should know these growths on your forearms. They're giant tumors.
I just realized how hard is not a healthy time. Why are the forearms huge and the biceps tight? And then second of all, what's with the cut? Is he always smoking? Because that's not healthy no matter how much speech you do.
And the speech thing and what you're doing with your eye, you had a stroke about 7 years ago.
That would make sense because you are able to open your eye.
Casey, join a screen share.
He has Bell's palsy.
Well,
It's nothing short of a miracle. I'd say about 2 months.
I'd say he should stop smoking. He should go to the gym and meet with a physical therapist and figure out why he's lifting solely with his forearms and not his underarm.
You should get a vasectomy.
First of all, I don't know what that is. And second of all, no freaking way. It's
JJ,
equivalent of a woman getting her tubes tied.
on your little knuckle.
Quicker and safer. Let these guys explain.
It is, and some people say it's reversible, but that's not really a good way to think about it. While it can be reversed in some cases, you should think of it as a permanent change. Excuse me, you still should be wearing a condom because of STI protection. A lot of these states provide manhood, but it prevents unwanted pregnancies. What does manhood have to do? All the incredible information you need to know about underwear right here. I said underwear. Yeah, my underwear, your underwear.
JC,
Look here. So, say that.
on your drink here.
When you're ready to begin treatment for chronic lymphocytic leukemia,
I gotta show you something.
and you can do the exploring. You can do the splashing, the sightseeing, and the playing. Calquence is an oral target.
Alright, so you're blocked.
CLL. More patients begin with Calquence than any treatment of its kind, and Calquence is proven to work better than chemoimmunotherapy in patients with previously untreated
It ended.
CLL. Calquence may cause serious side effects, which may lead to death. These include serious infections with fever, chills, or flu-like symptoms, and bleeding problems that may increase with blood thinners. Decreased blood counts are common and can be severe. New cancers have happened, including skin cancers. Heart rhythm problems with fast or irregular heartbeat, dizziness, feeling faint, chest discomfort, or shortness of breath have happened. Tell your doctor if you have bleeding, heart rhythm, or liver problems, infection, or if you are or plan to be pregnant or breastfeeding. Calquence helps you do the fighting, then you can focus on the things you're loving. Ask your doctor if Calquence is right for you.
I'm mudding, boy. Go and drink here now.
Hey guys, this week I want to talk about your unmentionables. Yep, I'm talking about your underwear. My underwear. A few weeks ago I partnered with
That's my four-wheeler I'm pulling out the water.
Now we're diving into your drawers. First things first, why do we even wear underwear?
Keep stuff in place.
You get protected from germs.
It's like a nice protective barrier between, I don't know, your pants and...
Pulling my four-wheeler out the water.
The materials that we think look good for outerwear aren't necessarily the best feel on such sensitive skin. That's the vibe I get.
The answer to this is
I'm at a full sender, you ready?
part practical. The area
Oh,
down
shit.
there is more sensitive than other areas of your body. The skin is more sensitive than, let's say, your forearm. And that makes it susceptible to chafing, itching, irritation, and underwear serves as a protective layer. On top of that, we're all human. The private area sweats profusely. There's occasional unintentional discharges, and you don't want that to get on your clothes, on your pants, on your skirts. It's easier to wash your underwear after a single use than to wash your pants or your shorts. The final reason why underwear should be worn is so that all times. That's really just a nice way to say the world doesn't need to see your genitals. By the way, who is the first person to look down and say, oh man, I need to cover this up? Let's take a look at the brief history of your briefs. 5,000 to
How did this happen?
7,000 years ago, there's the first evidence of humans wearing underwear. Fast forwarding to the 1500s, braids were now worn. In 1925, boxer shorts were invented. They were made for boxers.
Oh, underglow?
1935, briefs came into existence.
Basically.
1980s, thongs. 1992, the first ever boxer brief.
Oh, yeah, you ready?
So where are
We'll send her,
we
bud.
today? Well, Cotton Incorporated
Yeah.
did a survey to see what styles are popular now. According to the summer 2018 survey, 69% of men now own boxer briefs, versus 42% of men who own boxers. Coming in at third and last place are briefs, which are only owned by about 24% of men, making boxer briefs the preferred choice of underwear for men. For the ladies, the same survey found that half of women own bikini-style underwear.
Hold on, wait.
Preferred for everyday use and exercise. And for those special occasions, women went for thongs as their underwear of choice. Interestingly, this survey found that on average, people own 15 pairs of underwear. How many do you own?
Dude.
1 million. No, I do. I do have my drawers. I buy.
Do you see this?
A lot. Like
Don't mean as
100.
100 pairs of underwear. So you're a collector.
20. I'd say around like 25, maybe. 30.
Over 30.
Maybe 5 or 6 regular underwear. 10 girdle like underwear. I think she might own like 2.
I feel like we're gonna have a moment of honesty right now.
I'm like an underwear fanatic. 70.
It's an interesting question. I'm actually growing my inventory right now. I'd say 8 to 10.
I actually just went to check my drawer and counted 34 pairs of underwear.
Oh my god.
But why do they call it a pair of underwear?
Because it's got 2 little holes to put your feet in.
Maybe because I got 2 legs.
Did you see that, Casey?
That's brilliant, Mom. That's brilliant. Because I always carry an extra one in my bag.
Yeah, but I'm trying to find out myself.
Okay, I thought you were, yeah, expert.
They didn't teach me that about it in school.
Oh my god, I had no idea. Because you had 2 butt cheeks? I don't know. I have no idea.
2 legs didn't cross your mind, but 2 butt cheeks was right.
It's not even upgraded, bro. This thing's bone stock.
I guess there are 2
Hands have
holes.
2 legs.
I know, but I have a pair of legs for each hole, you know, it's just, I don't know.
Alright, let's get serious for a moment. What is the relationship between underwear and your health? I think it breaks down into 3 key factors. Fit, style, and fabric. Fit. And when I'm talking about fit, I'm talking about 2 types of fit. Loose-fitting underwear. It can also cause chafing of sensitive skin due to increased friction. It can hurt circulation. And worst of all, it can cause something known as nerve impingement. The nerve gets irritated and inflamed from constant pressure, and it creates numbness and tingling.
Oh yeah, we're going to the mud park in this one, buddy.
Numbness and tingling down there. Next up is style. And I know some of you pay attention more to the style than the comfort of your underwear.
Casey, I'm about to hit a ramp.
Do you generally look for style or comfort?
Style. The style, for sure.
Like you're actually not ready.
Style. Gotta look good, you know?
Style, which is silly because, like most people, I think I'm the only person.
Oh yeah. Oh yeah, baby.
I'm the only person that's, not the only person, but
When I'm in a relationship,
This thing just dominates.
definitely have like the style ones.
This thing just my picker hard.
Those are the ones that are just gonna like be on for like 10 minutes.
This thing makes my picker hard. Look at this thing. Uh-oh.
Because some styles of underwear can make you
Look at this thing.
take thumbs
It's fucking rolling, son.
to moving around. And when that happens, they can facilitate transfer of bacteria from the anus to the vagina. And that can make you predisposed to urinary tract infections. Also, the designs of some underwear, particularly G-strings, can make more contact with the vaginal.
I used to always watch this too, and then I got it on console with me and my dad, and we used to play it.
Irritation. We can't talk about style without touching on the boxer first brief. For the longest time, we were saying that wearing briefs can hurt the fertility of a man. The reason we thought that is because sperm don't like hot temperatures. And we thought you constricted the testicles and brought them closer to the body that increased the temperature and made men less fertile. But after the National Institute of Health and other organizations did some research into this matter, it looks like it's not the case. So the current recommendation is that you should just wear whatever makes you most comfortable. Next up is fabric. And I know people have their own personal preferences here. But if you ever visited a doctor and had a brief conversation about underwear, cotton was likely the recommendation that the doctor gave. That's for good reason. Synthetic materials like polyester are not as breathable as
This is the deepest mud hole that I've found so far.
moisture.
Oh, dude. Dude.
Bacteria or yeast infections. That's why one of the most common recommendations that doctors will make
Casey, how many bitches do you think I can fit in the back?
yeast or UTI infections is that you should
How many bitches do you think I can fit in the back?
When doing this research, I found a really interesting study that checked the
Oh yeah, you're right. How many brodies can I fit in the back?
of both polyester and cotton clothing, and they found that the polyester clothing had a much less pleasant smell.
Oh no, we're gonna hop on this bad boy right here. This is my baby.
And specifically, bacteria that create bad odors were attached to the polyester fiber. So if you want to smell better down there, you really should avoid those polyester. I can't let you go without me giving you some tips on how to wear your underwear. Tip number 1: going commando during the day is probably not ideal from a hygienic or privacy standpoint. But at night, it's not a bad idea. A little air down there at night can't hurt. Tip number 2: use a mild detergent or maybe even a hypoallergenic one for your undies. Again, you have to remember the skin down there is more sensitive than the rest of the body and is more prone to developing things like contact dermatitis, which is an allergic inflammatory response to perfumes or harsh detergents. Tip number 3, probably the most important tip of them all. After sweating profusely, and that could mean just being outdoors on a hot day or going out and exercising, you need to get out of your underwear as fast as possible. Change into a fresh pair. Because the longer you stay wearing that wet underwear, the more likely it is that you develop a fungal or bacterial infection. They love dark and moist environments. So now, you're an underwear expert, but I'll ask you this question. Do you know the style, fabric, and color of the underwear you're wearing right now? And without looking? Because I don't.
Okay, I actually have no idea. I really have no idea. That's so bad.
Lavender. The seamless one?
I don't know what seamless one does.
Green spray.
Okay, so I'm about to go download more mods. You need to tell me what to download.
Lining, bikini beige.
Tommy Hilfiger. Boxers. Light blue. Cotton.
They're cream. They have a Calvin Klein band, and they thong. Cotton. Boom.
And again, huge thanks to Cotton Incorporated for sponsoring this week's video. If you have any comments or questions,
Hey,
please jump into the comment section. As always, stay
Hey,
happy and healthy.
I'm turning off all my mods. Casey! Casey!
Let me outline the gastric bypass surgery procedure for you, okay? We put the band around your stomach so that no solid food may get through.
Well, that's not really gastric bypass. That's like a sleeve.
A very, very serious operation. Only undergo.
Casey!
The interesting part about bariatric surgery, why we recommend it, it's really the only form of lasting weight loss that we have really good evidence for. Other ways in which people lose weight 5 to 10 years later doesn't seem to be as effective. They seem to put that weight back on. But with bariatric surgery, the results seem to hold in a decent amount of the cases.
Kids, your daddy underwent a special procedure so he can be more attractive to your mother.
Well, I hope you're not doing it just to be more attractive. You're doing it for all the health benefits.
Welcome home, Marge.
You remember I like romance.
Do you like guys who are attractive?
Homie, you look good.
All for you, baby.
He looks like the mannequins in the men's clothing stores that you think the suit fits perfectly or the peacoat fits perfectly, and in the back they're all like pinned, and they'll never look like that on your body.
What are you hiding from me? Is it chocolate?
It used to be.
Whoa, those buns are popping.
Wait,
What?
those things, oh, he pulled into the front.
Doctor, I'm embarrassed.
I need you to tell me what to download, bruh.
And it's all because of your surgery.
You want me
I need you to tell me what mods to download.
You put a staple remover out.
I want you to give me every other.
I'm downloading stuff mods.
Oh, good. And can you pull in an aortic valve replacement so my
Yes,
insurance covers?
so we can play tomorrow.
Insurance fraud.
I need you to tell me what trucks to download.
Oof, my implants feel itchy.
Yes, I was out the silicone rubber, so I used rolled up socks.
He's a monster! Pitchforks, everyone!
You know, we're laughing at this, but you know, there's been this trend of
Hey, when it does this, what?
TikTok, and recently one of the biggest names who we've actually reacted to on this channel recently lost his
What?
life and switches to Instagram.
I don't fucking remember.
You better not make me cry, because I don't know where my tear ducts are anymore.
I appreciate you trying to become more attractive for me, but the truth is, I'm way too successful.
Yo, kick all these randoms at the party.
Getting me a trophy husband.
There's like 30 people in here that I don't know.
Where he's tearing up his head.
Sixers,
Wow.
I'm doing it for the
Where's on Fortnite? Let's on Fortnite. Did you kick him or did he leave? Oh, you kicked him.
You don't have to use defib paddles.
Actually, I need to get a new map. I don't like that map that I got right now.
I'm afraid your son has cracked his coccyx.
Based on the mechanism of
Yeah,
injury,
right here we go. Highway Hall.
we do in healthcare. We look at how injury happened. In fact, our professional sport
Alpha Perk.
when you work as a team doctor,
Oh my god, Monster Truck Arena. Subscribe.
over to the replay to try to understand exactly how the injury occurred, because that gives us the most amount of information about that injury. With what I saw happen there on the fall in the volleyball, didn't look like it happened on the coccyx. The way we diagnose, obviously, these fractures is through an X-ray, but just general pain of the coccyx is called coccydynia. For you to know. How long will it take to recover?
Wow.
It usually take weeks.
I got a problem too. I can't play GTA. You know why?
Initially, it is terrible. You have to get one of those little donuts to take the
Because
pressure
I'm gay.
off the middle portion of your spine when you're seated and really just sit on your ischial tuberosities. And actually, a lot of patients start taking non-steroidal anti-inflammatories like Advil, Aleve when they get pain after a broken toe. Some evidence has actually shown that taking non-steroidal anti-inflammatories can lead to poor fracture healing. For my patients, I tried Tylenol. If you need something stronger, Tramadol is an option. People really do request something stronger. I say lidocaine patch and love those.
I know CPR.
How about check his pulse?
That's when you can just compress into a BG song.
Yeah!
Deep is your love.
But you should check if he's alive first.
Deep is your love.
Are you sure it wasn't stay on the wrong song, bro?
Where's the Monster Truck Arena? Right here. Try. Monster Truck Arena, Monster Truck.
Yeah, and his positioning is not great.
Wait.
2 inches deep. Breaking us down.
I'm about to go into a Monster Truck Arena.
The purpose of doing
Oh my god. Watch my live stream.
because the heart is stopped. The person
My live stream while you go to sleep. Leave my live stream on. Leave my live stream on.
Solar eclipse is like a woman breastfeeding in a restaurant. It's free.
Okay. Just leave it on. I want to have viewers.
You don't want to stare at an eclipse. I mean, you don't want to look at the sun, period, because you could damage part of your eye known as the retina, develop something known as solar retina.
I'm gonna start screaming slurs.
Burn a part of your retina. This can happen with even a short period of time looking at an eclipse. And I know people make it eclipse, it blocks out the sun fully. Where are you going to get?
I'm gonna start screaming when we're getting bubbled.
It's only a total eclipse for a short period of time. When it starts moving and it's only a partial eclipse, that's when the damage occurs. And really, the damage happens on the point known as a fovea, where you lose the central vision, and then you get disorientation and color changes, all of that.
Okay, people, we've hit penumbra. Brace yourself for umbra. I'm gonna see it first.
No, I'm gonna see it first.
Yeah, looking through a pinhole, you'll get to see the whole thing happening without the damage happening to your eye. And also, people think, oh, if I just wear sunglasses, I'll be fine. That doesn't actually protect you, unless they're a special type of sunglass.
My space toy.
Oh, it's okay, homie.
Bro, it's a paper towel roll.
You'll miss the eclipse. There'll be another one in North Yemen in 2027.
We'll be talking about this together for years.
I can't miss out. Just one little peek.
No, don't look.
It's beautiful.
No, it's gonna hurt. Alright, it's not that quick, but there's no safe amount of time that we would say, oh, you can look at it.
Now, Marge, your eyes must stay completely covered for 2 full weeks.
There's actually no real treatment for solar retinopathy, but you still want to go see an ophthalmologist if you were to damage your eyes. Musculoskeletal injury incoming.
Boy, I tried ordering you, I tried punishing you, and God help me, I even tried reasoning with you, and the only thing left for me to do is jump the cliff myself.
You'll never make it.
You think I knew that?
Don't do it. I won't jump anymore. I promise.
Okay, come on. You know, boy, I don't think I've ever felt as close to you as I do right now.
Cervical neck fracture. C-collar. Now. You don't explode, but what you can develop is hydronephrosis. Your bladder is more likely to release and allow the urine to come out, and your kidneys start to explode. And by not going to pee when you want to go, you can actually cause like that urinary stasis to continue and develop infections in that area.
Yeah, that's what happens when you get older. It's one of those natural things. Beautiful in its way.
Actually, his kidneys were fine yesterday when he had his annual checkup.
I love that he's having x-rays showing the kidneys as the same visual as the spine. No, bones and kidneys do not line up the same. Look at any real x-ray.
I know, feel so good.
Well, yeah, you need to be on dialysis, sir, or get a kidney transplant stat. You can't live without a kidney.
Tell me something I can do like that.
Kidney.
A kidney? Okay, fine.
You see, the waiting list for a kidney is very long.
Yeah, in America, on average, if you are on the donor list, 3 to 5 years.
Oh, thank you, son. I'll take the left one. Gluten free. The right one without it.
You really can't feel the kidneys like that. And the fact that he has no kidneys, he's still moving around, that's nuts.
I gotta hate it. You're really ready to go through an operation.
Not an operation, Bo. Doctor says it's just a procedure.
That's a procedure. You're talking about deadly like brain surgery.
No, it's not deadly, but it's definitely a risk. You have to get pre-operative clearances by a family medicine doctor. That's what I would do. And what's interesting is put it in the front, in the lower abdomen. The point is, with only one kidney, you won't be able to drink yourself through. I mean, you still can drink alcohol. The idea is that you're at a much higher risk because you don't have a backup kidney. So you want to respect that kidney, meaning you don't want to overuse non-steroidal anti-inflammatories. You don't want to consume nephrotoxic substances. You want to make sure that you're always well hydrated. Feel me?
Well, that's what kind of one of those organ donor sucker lists. Everybody who has an eyeball or a spine or a visual tail will be after you.
I'm an organ donor, proud organ donor. Why aren't you? Change your license today. Can you imagine you could be one of the lucky people that gets one of my organs? Just saying. That's like better than merch. Hey, I got a Dr. Mike shirt. By the way, you get those down below. But hey, I got Dr. Mike's eyeball. I win. Dad, can I have fun with my joke? God! By the way, I gotta dispel that rumor that people think that if they get into an accident or they're sick, that if you go to the emergency room and they see you're an organ donor, they don't take good care of you. That's absolutely false. Zero have I ever heard of that. And if I did, don't you think I probably would not make myself an organ donor?
What if instead of donating one of my own worn-out kidneys, I gave Grandpa that artificial kidney I invented?
That was just a beer can with a whistle glued to it. But remember why you're doing this. Because you're your brother, the man who raised you and nurtured you.
You know what's interesting? When you get a renal transplant, you end up having to take immunosuppressant medication for the rest of your life. But still, the evidence looks like getting the kidney transplant, you live a longer life than someone who has to undergo dialysis multiple days a week. And odds are you'll have a higher quality of life because you don't have to always go for dialysis.
I love you, son. I love you, Dad.
Now, don't you fellas worry.
What's there Justin Bieber's girlfriend, Selena Gomez, had a kidney transplant from her friend, right?
So that was like 10 years ago.
Excuse me. I'm still mourning the loss of that relationship.
What the? We gotta get rid of that window.
Don't worry about old Grandpa. I'm going to a better place.
I just don't understand why they can't put him on dialysis. We have a lot of patients in the United States who are considered end-stage renal disease. They go on dialysis and they don't live a typically normal life. They have a lower quality of life because they have to be tied to the dialysis center. But they're alive.
I'm sorry, Dad. The way I behaved was shameful. I guess fear made me run away, but love made me come back. Bless you, son.
Now, Homer, this may sting just a tiny bit, but
Oh, son of a...
He's waking up.
Oh, homie, I'm so glad you're all right.
Hey!
while we were setting your broken bones and putting your blood back in, we helped ourselves to a kidney and gave it to your father.
You don't help yourself to a kidney. You usually have to sign off on that one.
Come on, Junior!
You know, it's pretty dark. In some countries, they actually sell organs. That's like a well-known black market for organ trade.
I know you're a little peeved at Grandpa, Dad, but you've done a wonderful thing. Yes, you've shortened their life significantly, so someone else can have a slight
He didn't shorten his life significantly. Come on, Marge.
I don't need 2 kidneys. I have everything I need right here.
You're tickling me.
Here's what happens when you eat McDonald's and only McDonald's for 30 days. Click here to check that out. As always, stay happy and healthy. Dr. House is out of control, but so am I. Let's watch this episode.
911, what's your emergency?
Got into an accident along the Canal Road, just outside Kingston. My mom's unconscious.
Are you hurt?
She should have asked does she have a pulse. If not, start chest compression. You're not fine. Metal object.
What's your name? I'm SEPA. And I'm working for
What is SEPA?
we have to do x-rays to make sure you don't have internal injuries, blood tests to measure infections, EEG for neurological anomalies, and biopsy of spinal nerve.
I love how he just decided that because he didn't like how she responded to the alcohol. So, and first of all, who puts alcohol on a leg? All you need is a little soapy water. Like, alcohol actually disrupts the skin tissue.
We've been about 16 documented cases. Yeah, and I have 7 reasons to think that she's one of them.
Or she has paralysis with her aesthetic and she's wearing a really tight belt. Come on now, shape up.
Reason number 1, she never wants without us telling her.
That's true, but she could have also been just acting dumb because some guy challenged her like you.
2, she's still wet from the snow. She's not shivering, that's all. Unless she can't sweat or feel hot and cold.
The ambulance is warm. I want to spend with her.
3, scarring around the lips and tongue. She was a baby, she chewed on herself without feeling it.
I fell through a window when I was a kid.
4, clean the wound, she flexed into the cleaners and away from her. It's hard to fake pain when you've never felt it. It's an imaginative Liz Morgenthau. She wants to see her mom. She wants having seen it. Not letting her go anywhere without a battery of tests.
If she already knows she has SEPA, why run the battery of tests? I feel like House just like wasting hospital resources.
Taking her to see her mom.
Can you imagine he's wrong and he just hit a poor kid? Oh, why am I laughing?
Is this a real case or one of those imaginary cases that happen when you're bored?
SEPA.
SEPA is a diagnosis. Diagnoses happen at the end of cases.
Thank you.
She's got no idea what's going on in her body. There's got to be something wrong.
In other words, she could be perfectly healthy, but you're curious about someone who can't feel pain because you always feel pain, so you want to go exploring.
Or maybe because she has SEPA and was just involved in a major car accident, you should pan scan her and make sure she doesn't have internal bleeding or injuries. Which would be a very simple test that House doesn't need to be present for and he can go home.
She was in a car accident. She needs x-rays, blood tests, EEG, nerve biopsy.
What does she need an EEG for? What are you looking for? If she's having a seizure right now, you can see if she's having a seizure.
Do your tests. Except for the nerve biopsy.
They need the nerve
You
biopsy.
risk paralyzing her.
What do you need a nerve biopsy for? Again, if it's congenital, we know. There's no need looking for a biopsy and a cause.
If the EEG reveals a problem, we can talk then.
But the EEG is not a defining test. EEG is going to show you brainwaves. Like, what is that going to tell you? Maybe they meant an EMG, and they're just using the wrong acronym? That's an EEG. No idea why they're doing it.
Spiking on leads C3 and R2.
She could be going into a seizure.
Oh, what is this? I don't understand. She could be? You can't see it?
What do you want us to do? Hold her down? Well, only until you inject her with a sedative, then you can let her go. We tried. Seriously? She's strong and doesn't care. We'd have broken something before we can get her to sit still enough to inject her. So, break her arm. She won't mind. You're cranky.
I'm in pain, and he's jealous of her for not being in pain. Little does she know, a world without pain is a much more dangerous and problematic world than we are.
Every morning, I have to check my eyes to make sure I didn't scratch a previous.
Oh, God, stop. I'm gonna pull the tears here.
I can't cry.
Neither can I. I check my eyes for jaundice. His vitamins finally shot my liver.
I can't run anywhere without examining all my toes for swelling.
I can't run. It's opposite ends of the spectrum. Neither are good. That's why we have homeostasis. You're sick.
No, your EEG was normal. Test showed no breaks. Blood test showed no infections. Urine indicated no.
Call a code.
Okay. You do not call a code because someone becomes unresponsive. She could be having a seizure. You don't need to call a code. A code is when someone's heart stops.
Need ice packs and cooling blankets.
What? Do you know what the condition is?
She's not flushed. She's not sweaty. She has a temperature of 105.